our final spring and summer education series for school-based healthcare professionals, utilizing health educators from the community to augment culturally aligned school-based healthcare. We are the School-Based Health Alliance, and we transform healthcare for students by providing technical assistance and training and support the improvement of students' health by creating community and school partnerships. We don't have any financial disclosures or relationships to disclose at this time. The School-Based Health Alliance, in partnerships with the Community Health Center, Inc. Weitzman Institute, presents the 2021 Spring and Summer Education Series for school-based healthcare professionals. Continuing education credits are available for the following on the screen. You will have until 9 a.m. tomorrow Eastern Standard Time to complete the evaluation. For today's webinar, all attendees are in listen-only mode, but we want to hear your questions. So to ask a question throughout this presentation, please use the Q&A function on the bottom of your Zoom control bar. We also have closed captioning for this webinar. To turn it on, you can just click on the CC closed caption button also on your Zoom control panel. And your evaluation survey for CEs will be provided in the chat box at the end of the presentation. For today's webinar, we're going to be using a platform called Google Jamboard. You should have received the links in an email beforehand. There's no prior preparation needed from your end, but we definitely encourage your participation. And we're going to be providing the link again towards when we get closer to that section. The objectives for today's presentation are to understand the critical role of health educators in providing culturally competent healthcare and breaking silos, identify best practices when working with youth who hold marginalized identities, and learn the importance of youth empowerment and leadership in working with health educators. These are our wonderful presenters for today. I will hand it over to them to begin their presentation and to have them introduce themselves.
Aloha kakahiaka, good morning from Hawaii. I'm not sure what time it is over there, but we just wanted to say welcome and thank you for joining us today. Our presentation is entitled Utilizing Health Educators from the Community to Augment Culturally Aligned School-Based Healthcare. My name's Malia, and I have my colleague here, Blaine, and we're gonna go ahead and share a little bit with you about who we are.
So just presenter disclosure, we have no relationships to disclose and no conflict of interest.
Today, our slides will include introductions of ourselves, the cultural history context of our community, the Waianae Coast Comprehensive Health Center, school-based health centers. We have an activity, as Maddie had mentioned, it's going to be on Jamboard, Breaking Silos, and health education impacts, empowering youth, and next steps that you guys can utilize to implement what we share with you today within your school-based health centers. So my name is Malia Augustin. I'm a health educator with the school-based health centers. I'm a graduate of Nanakuli High and Intermediate School, which is where one of our school-based health centers is located. And I am first generation graduate from the University of Hawaii at Manoa. I got my bachelor's degree and started working in the community, focusing on community health and doing research for asthma and also for nutrition amongst the Native Hawaiian communities. And then after that, I started working as a health educator with the Waianae Coast Comprehensive Health Center. I'm a mother of a 2-year-old. I'm 5th generation in Hawaiian Homestead and Nanakuli community. And so we have a long history here to be able to include and share our mana'o, our knowledge into the community as we work with them. So my olelo no'eau to you folks is, and olelo no'eau is a proverb, is kukulu ka'ike ika o pua. Knowledge is built in the cloud billows. And so I look to my God, I look to my kupuna, my family, and they're the people who have framed who I am. And if not for them, I wouldn't be here today presenting to you folks. So I'm very passionate and happy to be here to share. And with my connection to the community, I'm able to bring meaningful insight to inspire youth and their families to have healthier lifestyles. I'm going to pass it over to my colleague, Blaine, so he can introduce himself.
Aloha mai kako. My name is Blaine. I'm a proud resident and proud Native Hawaiian of the Waianae community, born and raised and still live out on this beautiful side of the island of Oahu. I just also want to mention I attended and graduated all the schools out here on the Waianae coast. I went to Waianae Elementary, Waianae Intermediate, and Waianae High School. So it's good to be back in the community working with the youth in these schools, as I was walking in their shoes at one point. After recently graduating from Waianae High School, I attended the University of Hawaii at Manoa as a first generation student as well, where I received my bachelor's in microbiology, and then soon after my master's in public health, specializing in Native Hawaiian and Indigenous health. Within that progress too, I was also interested in infectious disease. So I also did a graduate certificate from the Johnny Burns School of Medicine on focusing on infectious disease management and epidemiology within the communities. My main research goal when I was doing my master's was to really focus and bridge cultural aspects in how we deliver healthcare effectively in our communities. So that has been my focus. But as we move forward and we share our journey within our school-based health centers and working in our community, it has really perspired and grew into empowering the youth in the community, because they are the next generation, and they're the generation that's going to start to implement and make changes for themselves in the community. So thank you for having us, and we're excited to share this journey with you folks. So to kick off this journey, it's very important to us and dear to us to acknowledge and talk about the cultural trauma impacts that have affected us here in Hawaii, and especially the Indigenous population, as our community has a high percent of Native Hawaiians in the whole state of Hawaii, and also other Pacific Islanders. So we want to acknowledge that after post-Western contact back in 1778, a lot of introductions of diseases were implemented in the community, which really impacted and diminished our Indigenous population out here. And then also I want to talk about the healthcare mistrust that, as we'll share along, that what Waianae Comp is really good at in delivering and building off of is and bridging those gaps of implementing and creating a healthcare system that's supportive and built by the community, and really empowering to the community to deliver our effective healthcare measures. But I want to speak on behalf of a great example that happened when a large population of Native Hawaiians on the island of Molokai were stripped from their homes and exiled out in Kalaupapa for the spread of leprosy. So that I just want to acknowledge that these are the impacts that have happened in the past that have kind of built the mistrust of our healthcare systems. So we will speak on behalf of how our roles in the community and working through our Waianae Coast Comprehensive Health Center really supports and builds off of this, and acknowledging in the community to really deliver the healthcare that's been so successful in our community to today.
So this is our beautiful health center, the Waianae Coast Comprehensive Health Center. It was founded in 1972 by the community, for the community. And so Waianae Coast is the largest federally qualified community health center in the state, serving healthcare needs of the Waianae Coast, which is on the west side of Oahu. And so when I say by the community, for the community, we are on the farthest, most west point of the coast. And the hospital was very far, and a lot of family members and people from the community were not able to make it to receive those services. And so they decided to implement this health center for the community, because it was definitely identified as a need, and successfully we're still here today.
So our mission really is, we're a healing center that provides accessible and affordable medical and traditional healing services with Aloha. We're also a learning center that offers, or also a healthcare center that offers learning opportunities for our community, and really empowering the next generation to really come back and take a pathway in healthcare to really give back and be the future providers for our community. We're also an innovator and using new leading edge technology in our facilities to really deliver the high quality and accessible medical needs for our community.
So this is our newly renovated facility. It looks beautiful. The Waianae Coast Comprehensive Health Center, this is our main campus. You're looking at our specialty clinics, our pharmacy, and our ER. And so aside from this location, we have multiple satellite clinics. One is the Waiоla KWIC Walk-In Clinic and Adolescent Clinic. We have the James and Abigail Campbell Nanakuli Clinic, which is also newly renovated in the new Nanakuli Mall. The Waianae Oahu Community Health Centers, which are located in Kapolei and Ewa, and the Waipahu Family Health Center. And then we're going to share about our school-based health center locations.
So here pictured, we have 3 logos of our school-based health centers. And the thing that we really want to highlight here is that these youth logos and the names of these clinics on the campuses are really empowering the youth. And behind that is youth from these schools have developed and designed and named their clinics. So this really empowers them to really acknowledge that and the ownership of these clinics, because these clinics are really for them and it's really built by them. And we're just there to be the hands to really serve their needs. So by having this empowerment and having these names and logos stand for as long as our school-based health centers are in the communities and within these schools, I feel like that's truly empowering to have the youth, and the youth can reflect on this 10 years later and be like, or even 20 years later, when they have kids and their next generation comes in and they be like, you know, mom or dad, we named this clinic here out in your school. So I think that's really empowering, and the students really love that aspect behind that. So here you can see these designs.
So our school-based health center was established because in the community, a lot of families had mentioned that there's a high absentee rate. Their families are having chronic health issues, and the students aren't able to attend class regularly. And a lot of our providers were having to go to the courthouse to explain the chronic health diseases that our community were facing and the reasons why they weren't able to attend school regularly. And so in order to alleviate the stress that was being put on families, we worked together with the Department of Education, and our health center was able to establish these 3 school-based health centers. And so really we're now within the campus and able to assist the students and send them back to class. And so we want to share a little bit about what our services are.
So the services that we provide through our school-based health centers, and I want to recap the logos and reiterate that we have these clinics opened back in 2016, and we're located at Waianae Intermediate and Waianae High School, and then most recently in 2018 at Nanakuli High and Intermediate School. So our main services that we provide there are only for students. No adults are able to come to our clinic to receive services, although we do have some staff that do walk into our clinics to inquire about that, but we let them know that these services are only for the kids and students on the campus. So we provide primary care, which encompasses sports annual physicals, immunizations, general illness and injury care. What also makes it special is that we offer behavioral health, which we have a clinical psychologist who rotates to the 3 schools, and they provide clinical therapy and cognitive learning skills. So they really can help address learning behaviors in school and really help students who are stressed and struggling with school to really reevaluate themselves and assess how they're learning in their class setting. And then myself and Malia's position, which we offer health education that encompasses health disparities prevention education. We offer internships for youth professional development in healthcare career fields. And then of course, the longer ship is of us mentoring these students to ongo and pursue their healthcare path.
So recently, over the past 2 years with the pandemic, we were offered an opportunity to do telehealth through our school-based health centers. And so a grant from Kaiser allowed us to be able to renovate our school-based health centers. And this is the renovations at our Nanakuli School-Based Health Center, which shows the computer installation and furniture and painting that we did. And so the students were able to come into the school base, utilize the computer if they didn't have access from home, to then connect to our providers. And so this is a wonderful addition, and Blaine's going to share the Waianae location renovations.
So the Waianae renovations are almost complete, but the fun aspect of this too is also, it was really empowering for us as the team members of these clinics and who work in these clinics, because we were able to each choose a color and put them together to create this geometrical shape wall that you see here in this painting within our clinic. So these are just some of the walls that are currently painted, and we're slowly installing all the new tidal care systems and furniture. And just to also present on the school demographics that we work with. So for Waianae Intermediate, they have a population of roughly 926 students that is only for 2 grade levels, 7th and 8th grade. And 81% of them qualify for free or reduced lunch. And for Waianae High School, almost 2,000 students attend that school as well, with 73% of them also qualifying for free and reduced lunch. As for Nanakuli High and Intermediate School, they have roughly a little over 1,000 school population that ranges from grade 7 to 12th grade. So a lot of the kids from that Ahupua'a that we'll share later attend that school and have been going there for many generations. And they also have a student population that's at 74% that qualifies for this. So this really explains the social economic breakdown of our community and how economically disadvantaged a lot of these students are within our community and the families that we serve out here on this side. So for the Waianae aspect of the community and the Nanakuli aspect, we roughly fall in the 80% range of socially economically disadvantaged.
So collaborations with the school and the Department of Education has been the forefront of the reasons why we're able to provide services on campus. And so after successfully establishing our school-based health centers, the concern for health access was addressed. And now our next step was to increase awareness of our school base. So by request of the principals and the pediatricians and the teachers, myself and Blaine, the health educators, were able to provide students with culturally aligned health education presentations within the classrooms. And so presentation topics consisted of health disparities that heavily impacted adolescent populations, including prescription drug use and misuse, marijuana and ESD use, and suicide prevention. So here pictured on the left, you see our 3 principals, Principal Pilialoha, Principal Disa, and Principal Wataoka, and they're the principals of our 3 schools. And then you see our pediatricians, Dr. Via Sego and Dr. May Okihiro. And so these are wonderful mentors and people that we look up to that help us in coordinating the work that we do, and they oversee and guide us as we move forward as health educators within the schools.
So here in this point of the presentation, we're gonna also break down the aspects of a health educator role. And we thought this is very important because we are aware that some school-based health centers in the nation do not have health educators within their facility, and for many reasons that we've come to understand. So this, we hope, is beneficial for you and maybe potentially implementing this this important role for your school-based health center and the communities that you folks work in. So just a general job description breakdown. So our position really is there to implement disease prevention, health education, policy and environmental interventions through health educating, really specific to the school, the students, and the community that we're working in. And the way that this is developed is really working with the primary care providers, our clinical psychologists, the pediatricians at the main health center, who really oversee this, and how we can come together to implement the ideas that is being presented to us by the needs of the students, and how can we really bridge everything together to really deliver and create these health services for our school, through our school-based health centers. So that's the main role of aspect of where we come in. So we're like the bridge point that we'll share more as we go along. And then some health educator qualifications general experience, at least a bachelor's degree or higher within community health, public health, or any related field to that aspect. And then also experience in community health, health education outreach.
So the skills and job knowledge that's required of a health educator is experience in health-related area, working with adolescents, the ability to work effectively as a team with the school-based health center and school staff, community members, and district and state administrators. Good oral and written communication skills, flexibility, and ability to apply judgment and initiate in solving problems. Knowledge or sensitivity to the culture and lifestyles of the Waianae communities or of similar communities, ability to assess and plan within the cultural context, creative and dynamic attitude for developing appropriate health education, presenting information and working with youth, and the ability to be attentive to several projects simultaneously, good organization skills, ability to work independently and stay focused on a task. And so if you are interested in establishing a health educator, these are the things that you guys can utilize to put together a job description and begin to look out and reach out to the community to try and hire somebody like myself and Blaine, because when you have someone from the community who knows the history, who understands how to speak their language, it's received in a way that I think a lot of people are so open and welcoming to learning more instead of shutting down when it comes from an outside resource that they're not familiar with, especially within a Native Hawaiian community with all the cultural trauma that Blaine had mentioned earlier. And so we've been to legislation, we've taken the students to the courthouse, they've shared a lot of different things to try and implement policy changes on the ways and things that are impacting their generation. And so this takes a lot of encouragement and a lot of trust, and that trust is built through the knowledge that we have with the community. And Blaine and I work in multiple different pockets throughout the community and throughout the schools. And so really being organized and being able to work within all these different pockets simultaneously is a challenge. I'm not gonna lie, it's a challenge, but we are able to bring so much light and success and fruition of things that the students are bringing out into the community and voicing out their concern.
I also want to acknowledge, to name a few, that we're also blessed and lucky to have many funding opportunities that have come in to really to make our roles very sustainable in the community and the services that we provide additionally through our school-based health centers. So just to name a few, some of the grants that help supported us in the work that we do, it has been like an NIH ARC-21 grant, the Hawaii Community Foundation, the Harry and Jeanette Weinberg Foundation, and the Kaiser Community Health Fund. So it's possible. We're lucky to have leadership at the health center that is really creative. We're lucky to have mentors that really acknowledge the work that we do and our purpose in the community to really be creative and implementing and finding these funding sources for us.
So how to implement health education? We're going to take you through 3 steps to really help you guys to strategize implementation.
So first and foremost, this is really, really, really important, and this is super dear to my heart, is culturally alignment. And this stems for ourselves as community and proud residents of the community, and also for the new incoming staff and healthcare providers that are coming to work in our communities from wherever they come from. So the basis of this is really to introduce the school-based staff to the community, about our history of the community, who we are as people out here in the community, the cultures that we serve out here in the community, special landmarks out in the community. We emphasize cultural mo'olelo stories. So we really talk about certain areas and how they have significant stories that reflect maybe like legends, Papua and Wakea, which is the entities that give birth to Haloa, and how Makua Valley is a very sacred place to us as Native Hawaiians. We talk about that kind of things. We also acknowledge the homeless shelters that we have out here, the homeless population that we serve out here. We also talk about the drug plague that also affects our community dearly. I think that's something that's still happening in our community, and we see that with our youth, and we also share our personal stories that how that has impacted our families as well with our staff and the students. And then also the huge aspect of our community is the multi-generational household. So some homes even sometimes they have up to 5 generations living in one home. And how do we acknowledge that? And especially being harder now within this pandemic situation, how do we help address COVID outbreaks within those households? And then also taking the school staff on a tour and sharing the different ahupua'as, which is the different communities that we serve out here. So we have Nanakuli, Ma'ili, Wai'anae, Lulu'ole, we have Makaha. So we have like various different ahupua'as that we serve out here through the Waianae Coast Comprehensive Health Center. We also show them that, you know, families still out here live in Quonset huts. Why access to medical services for some of these patients is difficult because they live all the way back in Lulu'ole and there's no bus transportation. So for them to visually see and understand that these are access points that are difficult for our patients, and to understand why we do what we do in a community. And then also really emphasizing the culture practices that a lot of our patients out here use, like lomi lomi, la'au lapa'au, and the hi'uwai aspect. So the hi'uwai aspect of our cultural alignment as a team, unfortunately, we don't currently do this now because of the pandemic, but before the pandemic, before the school year would start, we would always gather together and we would do this kind of team retreat with each other and really understand and bond with each other. So it has been really empowering for our team with each other, and also a grounding experience. So it really helps us connect to our piko and our vahipana, which is our sense of place, for everybody to bring in what we know, but also know that you're welcome if you're not from this community, and you're ohana, you become our family here. So that's the main mission of our cultural alignment retreat as a team.
So step 2 is to kickstart health discussions with the students. And so we want to ask the community, we want to connect with them and really address what it is that's impacting them. And so that's the social determinants of health. And you see this diagram here that encompasses all these aspects of social determinants of health. So there's economic stability, community context, environmental impacts, access to healthcare, and then education. And so in order to connect with the students, we conducted a survey in our introduction presentation, and we asked the students, what health concerns are you dealing with? And what health concerns are your families dealing with? And so this is something that we presented with the School-Based Health Alliance back in 2016, and shared about empowering OPO. So giving the students a voice and letting them know that we're really here to listen to them. And what better way to provide care and services than by addressing their needs. So in this image of a person here, this kanaka, you see all the health concerns that the students had identified as #1 issues them and their families are facing. And so the larger names or the larger words are the ones that were more heavily impacting them. And then it gets smaller and smaller dependent on the things that they had shared. So maybe 1 or 2 people had mentioned that. So #1 on our list is diabetes and asthma. And asthma is one of the reasons why students weren't able to attend school. They have chronic asthma. And so that was leading to high absentee rates, which is why our school base was established. So it wasn't a surprise to us that asthma was one of the larger things. And then you look more at other issues that students had mentioned. And so there's things like cancer, alcoholism, heart attacks, disabilities, allergies, suicide, violence, infection, vision problems, injuries, Down syndrome. So imprisonment, there's so many different things. And these are all things that are coming from the students. And so we acknowledged that and tried to utilize the information started to implement and create programs and presentations for them. And I'm going to share a little bit about that in our third step, which is connecting to the students. And so health educators who create culturally aligned health curriculums and presentations to increase the health literacy and address the health concerns that the students had expressed. And so some of the presentations that we were able to create out of the survey that had been conducted. So we do an introduction to our school-based health services and community health, and that's where we introduce that survey. And we can continue as grades can graduate and more students rotate through, we're able to continue to increase our knowledge about the health concerns that our students are facing. And that's done through our community health presentation. And myself and Blaine are able to share our background and share that we come from the community and we understand that they're facing these issues. I give my personal stories about family members who are homeless or who have been imprisoned or who are addicted to drugs, and successes about family members who have become providers within the community. And so there's good and bad things, and we acknowledge that. We're able to bring in Women's Health Department providers to teach the students about reproductive health and STDs. And one of the first things that we had implemented in our school-based health centers was a request from the school that they had really seen that a lot of students were using things like codeine or Xanax and abusing prescription drugs. And so because of that awareness, we were able to implement understanding prescription drugs and the impact that it has on their bodies. And then we partnered under a grant with the Hawaii Community Foundation and started implementing the Stanford Electronic Smoking Device ESD Tobacco Prevention Toolkit, and we're able to get students certified in awareness for tobacco. And we present on tobacco, marijuana, alcohol, street drug awareness. And we partner with the Health Promotions Department from our Waianae Coast Comprehensive Health Center, where they're able to bring lungs in and interact with the students, and then even give them packets and information for them to give to their parents. So if they want to encourage their parents to quit, and what better way to have an impact on health than for a child to say to their parent, Mom, Dad, I really am concerned about your health. I want you to quit. And that connects families to the services that we offer in our health center. We introduced the Native Hawaiian health and traditional values, which is our Ha'ola village connections to our kupuna, and our providers there are able to bring light into history of the Waianae Coast and all the things that Blaine had mentioned in our first step. And then lastly, we introduced Inspiring Hope Through Sources of Strength, which is a youth suicide prevention program with Dr. Doug Gabert. And so really our students are able to receive so many different things because of us listening to their voices. And these presentations are implemented by myself and Blaine as health educators within the classroom. And from there, we can see a positive impact. And so on our next slide, it shows that as community liaisons, we are able to connect the students to address their health concerns and meet our clinic managers and our psychologists and our APRNs, our pediatricians, and they're able to communicate with parents and teachers about the needs that are being voiced. And so myself and Blaine, we're going to share a little bit about the warm handoffs that have occurred from the presentations that we have done. And straight from the classroom, we're able to really bring the students into receiving services in our school-based health centers. If you can go back one. And once the students receive services, they're able to, since our opening in 2016, our healthcare providers were able to see over 2,795 students. And of those students, 95% of them were able to return to class. And that's the success that we want. We want to be able to see and meet their needs, and then allow them to continue to flourish and thrive within the school-based location. Blaine, did you have an example you wanted to share of a warm handoff?
Sure. So one that really resonates with me, and I think and also was one of the first warm handoffs that have occurred with me, is we're presenting at Waianae High School, I think for a 10th grade English class on the prescription misuse program that we developed with the principal. And one of the students actually came up to me after class and was like asking, like, because we talked about behavioral health signs and symptoms of like anxiety, insomnia from the withdrawal effects of misuse of prescription drugs. And a student was like, oh, so that's what it's called. And I was kind of caught off guard because I wasn't sure what he was relating to. But when we finally were talking story more in private, he disclosed that he didn't know what that feeling was inside. And he would basically just wear headphones all day in school, and it wouldn't even be connected to his phone. It wouldn't even be playing music. But he felt that because he always felt like he was trapped and he couldn't express himself or talk or have a voice because of how he was feeling. He felt that the headphones was a protective measure, and because if other students saw that he had headphones on, they wouldn't try to engage with him in passing during research and stuff. So, well, after discussion, I was like, oh, we have a great provider at our health center. I'm more than happy to walk over with you to talk story with you, even stay with you in the clinic until we can get you set up with an appointment. And he was super happy, and he actually became one of our established patients. And his family also, in the long run, really thanked us because they didn't know how to address what was happening with him. So long story short, now he's like playing sports on the teams and fully active. And he's already graduating. He's off in college, but that's just one of the stories that I think was super memorable for me when we first had this experiences to our outreach that we have been doing on campus.
Yeah, I remember that. And I want to share a story when we took some students to our suicide prevention conference. And I had learned later on that during the conference, one of the students had, had a bottle of pain medication and was close to attempt for suicide and was in the level of suicidal ideation. And so after learning this, we were able to connect this student to the services they needed, communicate with the families, the concern that had been brought to light. And then the family had, jumped in to really support this student. And the student was afraid, but because of the connection that we had, we were able to really build this wall and help this child to know that they're supported and loved and cared by many people around them, including our school-based service providers, their family members. And then in another presentation, when our women's health department came in and they were sharing about, STDs, one of the students was concerned and wanted to make sure that something that they had noticed was not. And so we were able to connect them to services. And one of the beautiful things is we're able to refer them to the adolescent clinic outside of our school base if our services are not available on campus. And so the student was able to go to the adolescent walk-in clinic, the Waiala Clinic at Waianae Mall.
Kickstart our Breaking Silos activity that Malia is gonna share with you folks. So we just want to reiterate and reemphasize the aspect that we operate under multiple separate organizations, but we also have a common goal, and that's really to serve the community at its greater good. And really, how do we build our services to really support them, especially the next generation, the OPO of the communities, because that's where it's really going to start stemming from, and it's really going to start implementing the changes that we need for our people. So some of these steps in collaboration with other organizations outside of our community have been really supportive of that. Here, a picture you have like Papa'olakahi, and this is the movement that we were working on with the Eolo Mau report for the Native Hawaiian health study, and then the implementation of the communities coming together and sharing their resources for, to the community. And this was actually during the last week, I believe. And then so the steps is really just to identify the health issue at hand, research and work and collaborate with available services and programs in the community, and then really networking so that way we can jump these hurdles to get through what we need to do and really build the services that we need, and then creating the opportunities for the community to be involved in.
So we have a Breaking Silos activity. If you haven't yet done so, you can jump onto our Jamboard. The links are going to be shared here in the chat. You should have received the link by email. And there are 2 Jamboards just in case we run out of slots. We're going to ask that each department have 1 slot or 1 page, and you guys work together on the same page. So I'm going to share my screen here. So this is our Jamboard, Breaking Silos. And we're going to take you through 5 steps to work with us here. And if you navigate through, I'm just going to show you a few navigation things. On the top, you can slide through to view the different Jamboards. And so for each Jamboard, it starts from page 3 on. So your organization can choose a slot. Just start to label in your organization, department, and locations, which is located on the top left. And then on the left side is what you can utilize to start to type. Here's the text box, and then we're going to be using sticky notes. So step 2, using the sticky notes, you're going to add in your school-based health center roles in the top center circle. Okay, so you see here we have our Waianae Coast Comprehensive Health Center, school-based health centers, and our locations are at Waianae Intermediate, Waianae High School, and Nanakuli High and Intermediate School. And then our roles here, we listed our school-based health director, a pediatric provider, our research director and grant writer, our clinical psychologist, clinical pediatric operations manager, our SBHC lead manager, our nurse practitioners, our school-based clinic managers within each location, and then our health educator and research assistants. So once you fill in that, then you can go to our 3rd step. So if you have a health educator, you can place a sticky note for them in the hoops. And if not, you can choose someone from your roles that you list in the center as your liaison to place in the hoops. So we're in Olympic season, and I think this slide kind of looks a little Olympic with the hoops and the circles here. And so I want to just point out that there are hoops that you have to jump through as a liaison and connection within these different silos. And so myself and Blaine, we are in between these hoops, and we have to jump through hurdles in order to get to that success level. And so I'm going to share a little bit about those hoops and that in a bit, but I just want to give you guys a chance to fill in your silos, which is going to be our next step. So step 4 is to select 2 organizations you work with regularly to label your silos. Use the sticky notes to label roles and services offered from these 2 organizations. So you can see here our 2 silos we selected are the schools and then our Waianae Coast Comprehensive Health Center. So these are two separate silos, and within those silos, we labeled resources and individuals who are key to those organizations. So we have our principal, which is our permissions and gateway, our athletic director for sports health, our academy teachers, our school health aide, which is our emergency response and school-based health center gateway. We have our A'ali'i, which is a transitional school for students who are behind a grade level. We have our Papa Hana o Kai'ona, which is a transitional school for students who fall through the cracks. We have our performing arts and media production students who are able to film and be on media. So that's what we have in our schools. And then we have our Waianae Coast Comprehensive Health Center. We have our Healing Center, Ha'ola Village, Cultural Health and Identity. We have our Preventative Health, Tobacco Cessation Quit Support, our COVID department, our nursing program, Building Careers, development for students who learn about CNA, NP, APRN roles, behavioral health department supporting practicum hours, our research department, Pacific Alliance Against COVID, supporting testing capacity within the community. And we have our preventative health, which focuses on the farmers market and food access. So Kanaka Vai Vai in the center here is working together as a community. So this is human beings and wealth and importance. So in the triangle, you're gonna start to break these silos by bringing people together. So when we work with the schools, Blaine and I are kind of in a spot where we have to abide by HIPAA and we have to abide by FERPA. And that's the hoops that I'm talking about, where we're not fully able to access information for the students without permissions from the school, and the school's unable to access patient confidential services and things that are in their charts. And so we are able to kind of stand in the middle, see both sides, but make sure that they stay within their zones, but we're able to get that student the health care needs that they face. I hope everyone's able to follow through with our activity here. And so I'm just gonna do a quick check-in. I love it. I see people are inserting things on their slides. And you guys can do this on your own time in the future, but I just wanna give you an example of working together as within these different silos. And so the health educators and research assistants were able to connect services with the students. So we could bring together the principal and say right now we're addressing a sports concern where there was an outbreak within the athletic department for COVID. And so the COVID department is aware. And then we're able to bring this together with our Pacific Alliance Against COVID. And so right now the issue is an outbreak on campus for COVID. How can these groups work together and who needs to be present to be able to address the issue? And this is what we do when we break these silos. We try and really bring the key people together, strategize on how to address the problem, and then provide a solution working together through these different departments. And so within our health center, we're able to meet the needs because the need was voiced and made known. And then we're able to work with the schools directly from the top down. And then right here, we have our athletic director who's able to come in. And so we're just hoping that you guys can utilize this Olympic strategic platform to be able to start to work together within your organization to address the health concerns that our communities are facing. So thank you so much. We wish you well with this Jamboard activity. If you guys are able to continue working on it as an organization and strategize in breaking silos, utilizing health educators.
So why is this important? The importance is empowering OPIO, and I think this was emphasized throughout our whole presentation. It's really, 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 and it's something passionate to our hearts, passionate to our rest of our team members that work with us in the school-based health center and also at the higher ups of at our main center at Bionic Coast Comparative Health Center. It's really empowering the community and really empowering the next generation. So the youth voices are really the leading the way in our community. And that's been shown in our findings with our surveys. And it's made to our school-based staff. It's also made to the school staff as well. And we also share that in the community. So the importance about this is really gathering all the things that we're hearing within the schools and from the students, putting it together and also presenting it back to the community. So that way we can raise awareness and we can also get more community participation to really get the movement going. So that way these services are really built again by them and it's beneficial to them.
So this is our internships, 3 logos that were designed by our students and also by an organization that we partnered with, Inspiring Hope Through Sources of Strength, which is our youth suicide prevention, Nourished Youth for Hanai OPIO, our youth-led participatory action research from the YMCA, and the Youth Against Tobacco, which is a grant we received from the Hawaii Community Foundation, Na OPIO Ho'oki Puhi Paka. So these are internships, and we're going to share a little bit of the photos and some information about them.
So our first internship that we've our program that we had established in the schools were the Sources of Strength program. And these are some snapshots before COVID has taken over our communities here. And here pictured on your left, that's Dr. Deb Gabert, who is an associate professor at the John A. Burns School of Medicine, Department of Psychiatry. So she's been a huge advocate for the work that we do in our community and a huge mentor in our pathways, along with Dr. Villasego and Dr. May Okihiro, and even the rest of our team and the staff, because they really all come together and really make the services possible for what we do in a community. And the one you see here on the top right-hand corner, that was the mental health, State of Hawaii Mental Health Youth Conference, Awareness Conference that we had. So here's a bunch of youth from our 3 schools that we work with that were able to stay with us in the hotels, and they were able to get trained and certified in certain suicide prevention modalities, so that way they could apply it and be the leaders in their schools.
This is our Hanai OPIO Nourished Youth. This was also right before COVID happened. We met in January 2020 and were able to award them the paid internship position. And so these students were able to present on a platform. Their information is shared through social media and making a difference for students accessing healthy foods and also physical activity.
And here is our snapshot of our interns from our most recent internship, the NOP internship with the Youth Against Tobacco. So these youth are amazing as well, and they actually contributed a new aspect to our internships and our programs, because they all come from the Nanakuli Performing Arts Academy. So they're really good and really energetic in creating PSAs and doing social media outlooks. So these guys were all hired in the entrance of the pandemic. So they really took off and really the pandemic didn't stop them in the efforts that they want to do and promote for their community. And they sought off to social media, and they continue to do their health prevention and their coping skills and strategies for other youth in the community via social media.
So we have a video here, and just due to time, we're gonna allow you guys to follow our social media to be able to view this video. It's an amazing video. All the students wrote their script and came and presented together. And so if you want some inspiration today, please log on to our social media platform, which we're gonna share here, that you guys can view later. Thank you.
And I believe the School-Based Health Alliance will also share it in a separate email to all the registered participants.
So this is our platform. It's called New Health. Na Opio Owayanai Ola. That's what New stands for. And the students are able to share information to make a difference amongst their generation and their families and their community with the social media PSAs and messages that they put together addressing the health concerns that are impacting their generation.
So the work doesn't end here. We're currently in a pandemic state, and we had to repurpose ourselves and re-gear ourselves to really address our community at a different needs and keeping up with the pace of how everything is changing within the communities. I'm sure a lot of you folks can relate, but here's just a snapshot of our team and the efforts that we've been doing for our people in the next generation of community with our vaccine pods and also our COVID outreach efforts. So a thing that I want to highlight is at these pods, I think what makes us really unique is we try to make these aspects youth friendly and really engaging for the youth, and we create photo booths for them to really enjoy the atmosphere instead of coming in with the high anxiety and aspect and the high stress of what these vaccine pods are happening. So we hope that we're making a difference, which I think I can attest to that we are. But this is just some few of the photos that capture these beautiful moments.
We now want to open up some time for questions and time for us to give you some answers.
Yeah, thank you so much, Malia and Blaine, for that wonderful content. We invite you to put your questions in the Q&A on your Zoom control bar. It looks like we have one question already. It says, what is the feedback using telehealth from students, parents, and providers? Is it used often, or are they happy with the services?
Yes, I think it's well received. And I think the cool part about our Title Care health services is that the students actually get to use these tools on themselves. So they put the heart monitor on them, where the provider virtually can hear their heartbeat. They get to put the thing in their ear, where the provider on the other end can actually see and check inside their ear, as well as with the mouth. So I think it allows the students, and from what we hear, they actually enjoy it because it feels like they're also engaged in the healthcare that they're receiving, because they get to use all these cool tools on themselves. And also, not to mention that it's very safe in the aspect of what's happening with us in the community in the pandemic. So it allows that safety aspect to really still continue giving our effective healthcare in the community via Title Care and telehealth.
Yeah, definitely. Thank you. There was one other question in the Q&A that Malia, I saw you type the answer, but I'll ask it aloud so everyone could hear the answer. It said, with the telehealth portion, what is the process to receive parental consent? Do you try to connect with the student's primary care provider prior to using the telehealth, and what services are available on the telehealth portion?
Good question. I'll let you take this, Malia.
Yeah. So we established an electronic school-based health center consent form for parents to be able to access, and we also have Ascent that goes to the students. So it's all through email and then received through a protected platform where our clinic managers are then able to access our consent form. And the consent form includes the approval to use telehealth services. And so our PCPs are connected to the services if they're a PCP with the Waianae Coast Comprehensive Health Center. So they're then able to see the service was provided to the child and access the record and information that was inserted from our APRNs providing the service, as well as our clinical psychologists. So when it gets a little tricky when the student is not a Waianae Coast Comprehensive Health Center, regularly attending or receiving services from our school-based health centers or our Waianae Coast Comprehensive Health Center. If they're a Kaiser patient, there's an extra copay and a little bit of extra steps that they have to go through in order to connect with the PCP. So our clinic managers have to contact their providers, communicate the service, and then gain approval from both the parent and the PCP in order to provide that care. So, but the service is convenient and available for the students on campus, which most of the PCPs are happy that they have that access and are able to get it conveniently. So it has been successful for us.
Awesome. Well, thank you so much again, Malia and Blaine. Unfortunately, that's all we have time for today. Thank you everyone for being here. Don't forget to fill out the evaluation to get your CEs. And if you have any other questions for Malia or Blaine, we're going to send out their contact info so you can contact them directly. Thanks again.
Mahalo nui loa. Thank you guys. Take care. Ahui ho.
Mahalo.